Hello, warm welcome to this talk. Thanks for everyone who's asked about my well-being over the past week. I'm quite a lot better now, but I was fairly ill for about a week. Not ill enough to have influenza, but iller than you would expect from a cold. So I think I probably had COVID, probably Stratus XFG.3. Now, seeing there's just the two of us here at the moment, I'm going to let you into a secret. When I get an infection that I think is COVID, I take a medicine called Ivermectin. Now, of course, I'm not telling you what to do. I'm just self-disclosing what I've done. So over the past week, I've been taking some Ivermectin. This particular preparation here, we see this is the 12 milligram preparation. This is actually, I think it's manufactured in India, this one actually, but that's the one I've been taking. Again, not telling you what to do. This is purely what I've done. Ivermectin 12 milligram tablets, and I've been taking, when I took them for a few days, I took 2 a day. So the dose I took was 24 milligrams of Ivermectin a day, and from that I've had no side effects whatsoever. Now, at another time, I did take 12 milligrams of Ivermectin a day for 7 weeks for prostate issues, but that's another story, so I'm not going to tell you about that now. But I did take 12 milligrams of Ivermectin a day for 7 weeks and had no side effects again whatsoever. Just telling you what I did, as well as taking the vitamin C, the zinc, the vitamin D. Now, people that are low on vitamin D should probably take some of this. Again, your doctor will prescribe this for you, I'm sure, unless of course he doesn't. This is 0.266 milligrams. That's around about 10,000 units, I guess, of calcifediol, which of course is the activated form of vitamin D, and it comes in these rather nice, big, easy to swallow capsules. I bought that in, was it Spain or Portugal? Anyway, you can't buy it over the counter in England, but talk to your nice doctor and I'm sure he might prescribe you some. As with Ivermectin, doctors can prescribe this if they would like to do so. Now, I thought about telling you all sorts about the pharmacodynamics of Ivermectin, the way it clogs up the spike protein. No question, of course, in my mind at all that it's highly effective against COVID. Interesting question is, to what degree is it effective against other viral infections? That's an open question and one I'm not going to deal with on this video, but interesting question. I suspect it does have some antiviral effect. But what I'm going to do is I'm just going to read you a few clips. I've just dug out this book again that I've got a couple of years ago from Dr. Pierre Corey, who we've had the privilege of interviewing a couple of times on this channel, famous for his deputation to Senate, of course, about, first one was about steroids, then about Ivermectin. And I'm just going to read you a couple of clips from this, just to sort of, it just sort of sums it up really. So this is about Dr. Paul Merrick. So Pierre Corey talking about Paul Merrick. Paul was about to identify Ivermectin, the inexpensive, incredibly safe, generic repurposed drug, as a immensely effective and potent therapy against SARS coronavirus 2. It was discovered that it should have saved lives and ended the pandemic. It could have done that, he's saying. If not for one major problem. Repurposed drugs like Ivermectin are generally off patent, which means the manufacturers have lost the exclusive marketing rights. So, in other words, competitors can sell a dirt cheap version. So not only is repurposing of little interest to the original manufacturer, but any other big pharma companies trying to develop or promote pricey alternatives. So that's from this book by Pierre Corey. I'm just going to read you another little bit as well, because it really does sum up a lot of things. Again, this is Pierre Corey, Dr. Corey, eminent respiratory physician, of course, intensive care doctor. It's no longer a debatable fact, Dr. Corey writes, that treating COVID with Ivermectin leads to highly statistically significant improvements in time to viral clearance, time to clinical recovery, hospitalizations, and death. And yet, the medicine is not part of any official COVID protocol in the advanced health economies of the world. And if you ask people on the street what they know about ivermectin, I'm betting at least 6 out of 10 would use the words horse dewormer in their reply. So, no question in my mind ivermectin's effective, no question in Dr. Corey's mind that ivermectin's effective against COVID, potentially against other viruses and other conditions as well, potentially. We've talked about treatment of, some people have found it useful in various cancers, but we're not going there this evening. But Dr. Corey says, as the time of writing, and this was 2023 this came out, there are 95 studies from 1,023 scientists, including 134,554 patients from 27 countries that show ivermectin's efficacy. Based on meta-analysis of combined data, and meta-analysis have been considered the highest level of evidence, the researchers have to date identified 42 medicines and interventions that lead to improved outcomes in COVID-19. Now, here he's talking about the group C19 early. I'm going to put the link for them in the description. The vast majority of these potential treatments have been categorically ignored by the government and media. This is not a joke I'm making up, by the way. This is all from this book. I think Pierre Corey calls it Clownland. It's really bizarre. Further, there are numerous published studies of the effects of widespread ivermectin distribution programs from Paraguay, Argentina, Brazil, Mexico, the Philippines and Peru, all of which reported astonishing success in decreasing hospitalizations and deaths. In other words, ivermectin is one of the most proven medicines in history and also one of the most studied. I could go on and read you the whole book, really. It's a really good read, actually. But we're just talking about ivermectin specifically, the fact that I've been taking it. I've been taking 24 milligrams a day. I think I took it for 3 or 4 days just to get over the acute effects. And in my view, the earlier you take it in the infection, the better. So if you ask your doctor to prescribe some of this so you can have it at home, then if you do get COVID, then you could take it in an early stage. I would have thought that's what doctors perhaps might consider. Anyway, more from the book. In fact, a peer-reviewed paper on ivermectin in COVID by Professor Amara. This is Santoshi Amara, who discovered ivermectin, the ivermectins originally, which were developed into the ivermectins by William Campbell from a bacterium. So his team, and published in the prestigious Japanese Journal of Antibiotics in March of 2021, first authored by Monij Masha Jishag. My pronunciation in Japanese, of course, is non-existent. Yagishawa reported that in the previous month, a meta-analysis was carried out on 14,906 patients and 42 clinical studies, including 21 randomized controlled trials with 2,869 patients. The data showed improvements of 83% in early treatment, which is consistent with my thinking and, it's largely the thing I got from Professor Clancy, actually. But the data showed improvements of 83% in early treatment, 51% in late treatment, and 89% in preventing disease onset. So actually prevention there as well. Based on the results of these 42 trials, Yagishawa concluded that the probability that the judgment of the superior clinical performance of ivermectin is wrong is estimated at 1 in 4 trillion. So pretty likely that this is accurate. Just the last bit I'll read from Dr. Corey. Where things get interesting is when you look at the therapies that have been recognised or recommended by the US government to treat COVID. Nearly every one of them is a patented, exorbitantly costly, ridiculously profitable big pharma pill or injection. And I would add there with potentially rather nasty side effects as well. The only generic repurposed drug on the recommended list above is acetaminophen, Tylenol, paracetamol in England, which studies show has actually caused harm to the tune of statistically significant 27% increase in mortality. I'm sorry about sniggering there because we're talking about deaths, but it's just so absurd. The only drug that they're recommending that's repurposed is acetaminophen, Tylenol, paracetamol. And that actually is a statistically significant 27% increase in mortality. In other words, 27% people more die that took paracetamol in COVID studies. Unsurprising, Dr. Corey says, because the need to treat fevers, which are a protective physiological response to infection, is a pervasive myth. And I did say that, of course, I don't take paracetamol or ibuprofen with infections. So the body increases your temperature deliberately to help optimize the efficiency of the immune system. So there we go. Ask your doctor for some. Don't take anything or stop taking anything based on what I say. This is purely autobiographical for me. It's what I did. So that's just a brief video. Lots of preposterously interesting ideas in my mind for videos to come, God willing, over the next few weeks. And we'll finish there. But if you are following me on Facebook, you're not following me. It's a scam. So I don't post videos on Facebook. So if you're watching my videos on Facebook, unsubscribe, cut it out, because it's not me, it's a scam. The Facebook sites with me on doing videos are a scam. They're not me. Also, I never do AI. So if you find a video with me doing anything where I am AI-ish, trust me, it is not me either. Seem to be getting AI'd and cloned and a lot. And while I'm at it, if you see a video of me doing a cure for impotence, that's not me either. That's an AI scam. So don't fall for them. It's not me. The only place I post videos are on YouTube and on Rumble. That's it. Apart from that, it ain't me. And the only reliable links that you can use to communicate with people or with me, or donations to charities that we support, are on the links to my videos on YouTube descriptions. So there you go. That's what I've been doing over the past few weeks. Feeling much better now. Actually, still quite a bit short of breath. I was climbing a ladder today and I was a bit puffy panty at the top of it. Not that I would recommend climbing ladders at my age, of course, but I was. And, so it takes a bit of time to recover. You know, there's an old-fashioned concept called convalescence, where you take time to recover, which of course isn't really allowed in our modern world, but is one heck of a good idea. So thank you for watching. Do talk to your doctor if I've given you any ideas. But that's just what I do, not making any recommendations for you. But I took 24 milligrams of Ivermectin in two 12 milligram doses. 12 milligram doses, 24 milligrams a day. And I did that for 3 or 4 days, just during the acute phase of the infection. And I'm pretty sure it helped. Thank you for watching.